to the femur. So there'll be questions about the greater trochanter, the lesser trochanter, and so on, in various parts of the femur, the largest bone in the body. Okay, let's look at the tibia and the fibula. You should know these structures. Use this as a reference. Uh, when you work on the modules for the guided notes, you'll go through all of these parts of the bone. Okay, we look at the ankle. All I want you to know is that uh, these are the tarsals, and then you have the metatarsals and the phalanges. So if we again look at that picture, you should just need to know that these are the tarsal bones. I'm not going to ask you calcaneus, talus, navicular, and so on, but then you know you should have metatarsals and phalanges. Types of joints. Make sure you pay particular attention to the different types of joints in the modules for the guided notes. There are synarthroses, immovable, slightly movable amphiarthrosis, and fairly movable diarthroses. So suture, gymphosis, and a synchondrosis, those are the different types of immovable joints. Syndesmosis and symphysis. And we have somebody coming in. Admit. Okay. So make sure you pay particular attention to these categories and make sure you know what all of these examples are. And those will be uh, quizzed on WebAssign. Okay, synovial joints, there will be a question uh, using an image just like this. Uh, you have the femur here, and it could be a knee joint, the femur, and the uh, tibia. So make sure you know the uh, particular parts of a synovial joint, a movable joint. Again, look at these presentations, know about bursa sacs, the joint capsule, and so on. Okay, we're not going to worry about these movements. Okay, we're not going to worry about the structural classification of joints. The greater the mobility of a joint, the weaker. So you need supportive muscles and you need to exercise and uh, keep your muscles in good shape to support your joints. We're not going to worry about these right here. All we want to know here is that the vertebral bones are uh, interlocked together, and the intervertebral disc is the fibrocartilage that forms the disc, the cartilage between the vertebral bones. We're not going to worry about the shoulder joint, elbow joint, hip joint, but let's look closely at the knee joint. Uh, so you have the anterior cruciate ligament. Behind it is the posterior cruciate ligament, and so on. The lateral meniscus, the medial meniscus, and uh, there'll be questions about the knee joint within WebAssign. Okay, that's at the end. Let's go ahead and save that. Go back to record, stop recording. Okay.